have now a total of 237 confirmed cases of COVID-19. And of these, 124 have recovered, 10 are hospitalized at this time, and a total of 15 deaths. When I last spoke with you 2 days ago, I indicated that we had 218 reported cases. This means that we have an additional 19 cases since then. 14 of those are what we're calling sporadic cases, cases out in the community, and the rest of them are associated with facilities. So we've had 3 additional cases as part of the Bradford Valley long-term care facility outbreak. We've had an additional case at Woods Park. This is a staff member, whereas the cases at Bradford Valley were among residents, 2 in their 70s, 1 in their 50s. And we also have another case in a group home in Bradford, West Gwillimbury. I won't be naming the group home because they typically have small numbers of residents, and it would be too easy for people to be able to identify the individual, and we need to protect privacy. If I look at the community cases, the sporadic cases, their age ranges from less than 10 to the 80s. They're all in self-isolation, none are hospitalized. 2 are close contacts of other cases. 1 is travel-related, 9 are community-acquired, and 3 are under investigation. This is where I always emphasize the importance of noting those community-acquired cases, that this is an indication that there's transmission happening in the community. There are asymptomatic cases, we know from research. The potential to get infected by another person in the community is always there, so you need to be exercising the physical distancing, 2 meters set back from other people, avoiding crowds, carefully considering whether you need to go out at all, hand washing frequently. I think being very careful about decisions of going shopping or other places where you could encounter other people, doing so the minimum number of times that you can get away with in the week. Ideally having 1 household member doing that kind of thing. And for those who develop symptoms, you need to go into self-isolation and contact an assessment center about follow-up for testing. We know that the capacity for testing now is enhanced, and although there are priority groups for testing, in my mind it's helpful for everybody who has the symptoms to be tested, and therefore people should be calling to see if they can get tested if they have symptoms, respiratory symptoms of COVID-19. So we have, thankfully, no new deaths today. We remain with the 15 that we've had to date. No new hospitalizations. Currently 10 hospitalized, 4 of those in ICU care, and we've had 12 cases recover since I last reported. If you go to our website, I've already pointed out that we have a link to a health maps where you can have a look at how this affects our local municipalities. And if you scroll through the data on our health statistics, you will find the usual summary information that the largest number of people to be affected are in the middle age range, 35 to 64, the next largest being those 65 and above. If you look at the status of individuals, 124 have recovered in total. We have 61 in self-isolation, 26 isolated as part of outbreaks in facilities, 10 hospitalized, 15 that have deceased. And if you look at where people acquired their infection, the largest group is community acquired. So 81 of our cases community acquired, 54 as close contacts in the community, 34 as part of outbreaks, and 53 as related to travel. If you look at our epidemiological curve, the cases per day, based on when their symptoms began, you see a flat curve, bit of a sort of sawtooth pattern, but generally flat. This is an indication of the success we've had together, collectively, all of us, in controlling this outbreak, in flattening the curve. with the physical distancing measures that we're all employing. So if I were to draw your attention to actually, I think I'll just touch on a few things from my notes here. We have, I think I've said in the past, a total of 3 outbreaks in long-term care facilities, IOOF and Woods Park. IOOF remains with a single staff case. Woods Park has now 2 staff cases, and Bradford Valley has a substantial number of cases among their residents as well as their staff. The staff cases, in the past I'd indicated that there were a total of 10 and that 3 of them were from out of district. When we look back at our data, we're actually incorrect on that. 4 of them are from out of district, therefore the remaining 6 are from within our district and in our statistics. We've done a tremendous amount of testing at all of these sites, and over 500 tests have been done at Bradford Valley. We've done now a total of 800 tests between the 2 new sites in Barrie at Woods Park and IOOF. And at this point, I'd like to very much commend the partner agencies that have come together to achieve this. So the province has dictated that we are to come together as a healthcare community locally and partner in order to support and protect our long-term care facilities. And so in Simcoe, Muskoka, as your health unit, we've worked with hospitals and EMF, or I beg your pardon, EMS, Emergency Medical Services, including Simcoe County Community Paramedicine. We've worked with assessment centers and primary care, local hospitals. So in the case of doing those 800 tests for those 2 long-term care facilities in Barrie, I'd like to acknowledge the support of the Royal Victoria Regional Health Centre, Simcoe County Community Paramedicine, North Simcoe Home and Community Care, the Assessment Center in Barrie, and also with regards to our response for Bradford Valley and the testing done there, South Lake Hospital and their Assessment Center team. I'd like to acknowledge all of the collaboration coming together to be able to do that very large volume of testing, and of course I want to acknowledge the public health laboratory system as well for being able to do those tests. I think at this point I would like to talk a bit about the role of public health in the response to the pandemic. So we know that what's absolutely critical and important with this pandemic is that we flatten the curve, and that means together breaking the chain of transmission so that we don't get a huge surge of cases that could overwhelm our healthcare system and overwhelm our intensive care units, and exceed the number of ventilators that we have so that we lose more people than we otherwise would. And we've been successful in that, and Ontario has been successful in that. We remain very much, I would say, struggling across the province to protect long-term care at this time. That's a priority right now very much for us. And we've seen all of these healthcare agencies come together to do that here in Simcoe, Muskoka, but also elsewhere across the province. But otherwise, we've had success in flattening the curve, and according to the province's reissued model of where the pandemic is going, they now indicate that we're on a trajectory that is the most favorable outcome. So instead of having, by the end of this month, 80,000 cases of COVID in the province, we're more on track to have 20,000. So reduced by 3/4, and considerably less than what it would have been if there were no controls at all. It would have been much higher than that. So to flatten that curve, that really required the physical distancing and all that the province has done with direction and directives and policy, the closure of schools and non-essential services and businesses, and outdoor recreational locations, and the prohibition of gatherings beyond 5 people, and all of the messaging that's come out of the province about not going out unless you absolutely must, and not traveling to other communities, staying at your primary residence. All of that's been critical. What's also been critical is the way people have abided by this and complied with this. I feel it's been overwhelmingly complied with. There's been reported instances where it hasn't, but on the whole, people have been very compliant with this. And the role that public health has played in all of this is we've supported all of that messaging, and we've done our part with raising awareness about this, and we've done our part about the enforcement side of all those directives. And we've done all of the case and contact tracing and follow-up that's been happening in the province. So we helped to set up the assessment centers, and that's made it possible for people to go get tested, and then we receive all of the positive test results as soon as a family physician or attending physician also gets the results. And we have called up all of those individuals within typically a 2-hour period of receiving that information. And we have therefore been able to get to those people and put them into self-isolation and provide them all the information they would need as to how to do that successfully, and have identified their contacts and have followed up with those contacts and put them into self-isolation and provide them with the information they need to be able to do that successfully. And we know from research that physical distancing that we've supported and the government has led, and the testing and case and contact management are the key things that have flattened the curve, that have greatly reduced the number of cases, maybe reduced it down to 5% of what it would have been otherwise. So I think it's important for people to know that, and I want to give a little bit of information about what it took for us to be able to do that. So first off, we had to redeploy almost all of our staff to this cause. So right now on our disease investigation team, we have 102 people, and that's public health nurses and public health inspectors and administrative staff and data management assistants, drawn from all of our other programs that have been put on hold, put in our sexual health program, our family health program, immunization program, chronic disease prevention programming, food safety, water safety, vector-borne disease programming, across the board, the range of what we do, child and reproductive health, largely put on hold while we've redirected all those staff to do this, put people on phone call receipt through our Health Connection line so that we'd be able to respond to people's calls as well. So right now, although we have just over 200 cases in Simcoe, Muskoka, we at this time are investigating 1,700 contacts, potential cases, a much larger group of people that we are presently investigating, and we've completed to date 4,300 investigations. So for every case, there's a much larger number of people that we have to follow up with and investigate. And this, of course, is a tremendous amount of work and time, and each and every one of those cases, potential cases, contacts, put in isolation means that they're not transmitting in the community to other people and helping to flatten that curve. With regards to our Health Connection line and being able to receive calls from people who may be cases or concerned about their contacts or having other questions that need to be answered to empower them to avoid becoming cases or transmitting to others, we've had a huge increase in our calls. So right now we've had in the range of a 10-fold increase in the number of our calls, and so Yesterday we had 171 calls, but at the height of our response, it was more like 100 times the typical volume in a single day. So on March the 16th, after we had our first death reported, we had 1,200 calls come in, and so we've put many more staff onto our line and extended our hours into the evening and through weekends, and we have both the phone management happening at all those times, and also we have the case and contact management happening 7 days a week. So I just felt it would be important for people to know what it's taken, that we're completely dedicated to this. We've been doing this for weeks, and we will continue to do this for as long as it takes. We anticipate weeks to come before this first wave is under control, and we anticipate that we're going to have future waves throughout the world and in our community until we can administer a vaccine, until a vaccine is developed and manufactured and provided to us to deliver, which will be a year and a half or more out from now. And when I look ahead to that task, that'll be a final grand challenge for us to be able to provide that vaccine in a staged fashion to the entire population. So just felt it would be important for people to be aware, and really want to acknowledge my staff and how dedicated they've been, and the long hours that many of them put in, and the unusual hours that they've all put in. Some information that we've just put out on our health facts to healthcare providers is about immunization. So one of the many things that have been disrupted with the pandemic, and with us in public health having to redirect our resources to our response, and also the disruption that it's had in medical practices, where physicians are now seeing patients mostly via distance through the internet or by telephone, is that we can't administer vaccines in the same way that we would normally be doing. Same with schools. There are vaccines we provide in the schools, and with schools closed, we can't do that. And so we've got information about what's critical to get done for vaccination, noting where some vaccinations are going to be delayed until we get the chance to do them, such as reopening of schools, and noting what vaccinations family physicians, primary care providers need to be thinking about. How are they going to administer those to their patients, and in what altered kind of a way with the schedule are they going to be needing to do that. It's been pointed out to us that we need to get back on track in the near future about all that we do, because all that we do in public health is to prevent disease, prevent other outbreaks, whether they be vaccine preventable disease or foodborne or waterborne, and not to mention all the other things we do to prevent chronic disease or support healthy child development and reproduction. So we now are working on developing a business continuity plan about how we're going to get back on track for those things and be able to keep them up over the year of the pandemic, the year and a half of the pandemic to come. One of the key things about vaccination is, although primarily it's children that receive them and those in their adolescence, there are vaccines for seniors, and they're very important too, but we are recommending that be put on hold because of the potential for people over 70 to get COVID if they leave their homes. So we're going to have to wait until the present wave is under control before you can catch up on that. I had some comment back, I would say, with regards to the question of people traveling to cottage country. And some people have told me that I need to speak out more about people not doing that. So certainly I have supported messaging from the Premier and others, local politicians, that people need to stay at their primary residence and not go to secondary residences or cottages or cottage country at this time. And I raised that even today on a teleconference, a Zoom meeting with the CIOs for our municipalities in Simcoe, Muskoka. And what I heard back from them was the issues they're facing in our more northern regions where people cottage right now is that there are more people than they've seen before in previous years going up at this time of year, and yet at this time of year we've got a constraint on essential services and potentially a constraint on the supply chain for food and other provisions, and that having more people in these communities at this time than those who live there puts a strain on these services, access to these services, a strain on access to food and other essential services and products, and also a strain on the ability of these municipalities to enforce the physical distancing requirements of the province. There has been concern in the past about the potential for cases to overwhelm the local healthcare system. We've not seen that because we've succeeded in flattening the curve, but we need nevertheless to be mindful of all of those other issues. So I am stating again the importance of people not going to their cottage at this time during the pandemic, during this wave, and choosing to stay at their primary residence. And I've communicated this to the Chief Medical Officer of Health, Dr. David Williams, and I've also suggested that the province might want to consider beyond just telling people they shouldn't do this, that they should consider other measures to discourage people going from their primary community, their primary residence, to cottage country residence. So some ways that they might want to consider, I've stated before, is suspension of fishing licenses, hunting licenses. But another possibility would be that the Premier include a prohibition of people using secondary residence at this time and having to stay with their primary residence. So that is an idea that I've communicated to the province. We did have a question last time about testing for those who don't live here. And I'd explained how we tally our numbers, and basically we include in our numbers those who live here, as well as those who tested here and are recovering here, but we exclude those who test here but then go back to their home, their primary residence, out of our district. And I was asked how many of those cases, the individuals tested here but leaving to their residence out of district, how many have we had? And I indicated that we've had 33 to date. And there was a request that I break that down between Simcoe and Muskoka, and unfortunately we've not been able to do that in our data to date. So I'm afraid I can't give you that particular datum that you would want. Looking at a couple of other questions that have come up. There's one here about the Spartan test, or testing, a new test that becoming available. An individual wanted to know what we know about a new point of care test that has been in the media, and we don't have it yet for our use. What we've heard from the province is that they are interested in making it available. They would be most interested in making it available in remote settings, communities in the north where it's otherwise difficult for them to get tested. So we await receiving that. We've also had a question about expanding the testing guidelines from the province and whether we've seen a change in the speed of test results received. And so it's still in the range of 1 to 2 days of turnaround. And there's a question about whether it's taking longer due to the broad testing that we're now doing in long-term care. So the province has directed that we are to test all residents and staff in long-term care facilities that are in outbreak. So we already have been ahead of the province on that in Bradford Valley, and we've conducted that in our 2 outbreaks in long-term care facilities in Barrie. As I mentioned, 800 tests for those 2 sites in Barrie just since yesterday, so that's an enormous feat. We will have to wait for the results back on that. And I think one of the things we need to be aware of is if we then go beyond that and test All other long-term care facilities, even those that aren't in outbreak, as the province has directed us to do, it's going to take quite a while to do that. We're going to have to set up a schedule of that, and it's going to be limited in part by the supply of test kits and the testing capacity of the province. There's some 200,000 people in the province that live in congregate settings of this nature, so long-term care facilities and group homes and correctional facilities. That's a lot of people. It's certainly more than the numbers that the province can test right now. They're testing in the range of 10,000 tests a day in the province, and possibly could get up to 17,000 a day, but it's still going to take days, many days, before you'd be able to cover all of those people, all of those facilities. So we'll have to stage it over time and focus in on those facilities that we think are most vulnerable. And this is different from providing them with support in general. We're definitely committed to working with the teams we've set up in acute care and with the other agencies in the community, the healthcare agencies, to be able to provide support to our facilities about infection control and human health resource. We of course would continue to do that, but the staging of the testing is just going to take weeks, I would say. Has the health committee any further recommendation to assessment centers to increase their testing? So what I see is that the assessment centers are doing a good job of testing those that are coming to them. I think what needs to take place is people being aware that there's the opportunity for them to get tested if they develop symptoms, that people need to contact them and come forward to seek that testing. And we do maintain contact with these facilities on a daily basis to ensure that that they're operating well, and find out if there's anything else that's needed, anything else that we need to do to support them. So at this time, I would be happy to take questions.
Thank you, Dr. Gardner. Chris Simon, do you have a question?
Yes, I do. Thank you very much. Can I get some details on the second staff member at Wood Park? Is there any indication whether this person showed up for a shift, or what their exposure was? And also, too, I'm just curious whether it was one of the cases that were reported yesterday or one of the 4 cases reported today.
I don't know whether they were included yesterday or not. This individual, both the individuals at that location that are staff that are positive are identified as having acquired in the community. At this time, we are investigating about other potential contacts. I don't have specific information for you about that, but we have taken tests from absolutely everybody in that facility and are awaiting the results.
Just curious whether there is a rhyme or reason why you see kind of the day-to-day fluctuations. I know, the graphing will show you longer-term trends, but why you might see 15 positive tests, for example, yesterday and 4 today. Is this something due to when test results are coming back, or is there something larger that you're seeing at play here?
Thank you for that question. And if you actually look at the epidemiological curve that we've got on our HealthStats site, you'll also see a sawtooth pattern. Now that's plotted not by the date that we got the results or the day that we reported the results. Instead, it's plotted by the date of onset of symptoms. So it too is fluctuating somewhat from day to day. And I guess the only answer I would have is the smaller the numbers, the greater the variability in the numbers from day to day. You'd probably, if you looked at the province's numbers, see with a much bigger data set, much less in the way of day-to-day fluctuation. But other than that, I actually don't have a good explanation for you. What I think is key in that data is the trend. And the trend is relatively flat, not an ever-increasing number of cases over time. That is very positive and suggests that we've flattened the curve, that we've gotten this largely under control. As I've indicated, it doesn't mean it's over by any means. We have to maintain the control measures because that's what's responsible for keeping it under control.
Thank you.
You're welcome.
Thank you. Thank you, Chris. Erica Engel from Collingwood Today.
Hi.
Hello.
My question is a follow-up. I noticed yesterday, I haven't checked today, there were some new cases in places like Aurelia and Ramera where there hasn't been cases reported since 2 weeks ago or even as far back as April 1st. Could you comment on what would, I guess, why would we be seeing cases even though it seemed like there was none for a long time? And these were cases of community transmission.
So I always maintain that with surveillance, you're getting the tip of the iceberg. You're getting maybe 10% or even just 1% of what's happening in the community, because so much of this is asymptomatic or people with very mild symptoms who choose not to be assessed. And then earlier on, we had people who wanted to be assessed but couldn't be tested because of the limited volume of testing available. So if you're missing most of what's going on in the community, it's less surprising to me that in some smaller communities you're only going to see the occasional case. I think the takeaway message is it's still circulating in the community, it's circulating in all of our communities, and people everywhere need to practice the physical distancing that I've been promoting.
Thank you, Erica. Do you have a follow-up question?
Yes, please. I wanted to ask more about the other programs that the health unit has put on hold. I know you said you were working on a business continuity plan. Are you worried about a lapse in vaccinations or the services that you provide when it comes to reproductive health or raising babies?
Thank you for the question, and indeed, the longer this goes on, the more concerned I become. In no way could we do this without very negative consequences for a 1.5 year period. And so we absolutely need to be able to get back on track in the not distant future. I wouldn't want this to go on really without getting at least some of our program in place within a month. Because the longer you go, the more likely you are to have something break down. A lapse in vaccination eventually could mean a cohort of children that are vulnerable to measles or other vaccine-preventable diseases. And something like measles is very contagious, and if you have a sizable number of people without protection, then you could easily have an outbreak. Same with restaurants. Right now, for the most part, there's far less in the way of people accessing restaurants. They still can for takeout, but it's much lower volume. Once the province eases up its controls and allows some return to use of restaurants, then we will need to be back there making sure that the food is safe, that there aren't lapses in food handling practices, for example. And of course, babies are going to continue to be born throughout this whole period of time, and we've been providing home visits for at-risk mothers, and that, we've been limited in how much we can do with that, and it's had to be done by phone because of the physical distancing requirements. So those are instances where there's definitely vulnerability, and there's a cohort of babies being born where we normally would be providing breastfeeding supports in classes, and it's been really a great reduction in our ability to do that. So that's potentially a cohort, a group who may not initiate breastfeeding to the same degree and be missing out on those health benefits. We've been unable to enforce tobacco control legislation at this time, and so there's the potential for enhanced or increased illegal sale of tobacco to youth or provision to youth. There's a potential for a generation of youth to become addicted to tobacco and be the same with vaping. So we need to get back to our programming. We need to then come up with a plan that would allow us to continue to do all of that programming in the future, while we also ramp up for case and contact management and phone call management at points in the next 2 years in which COVID returns, in which you get future waves. We have to figure out how to do both.
Does that mean you're going to have to hire even more people?
It's a very good question. It might mean that, right? If you think about how are we going to be able to do both, I'm sure we'll have to do some redeployment of some of our staff again in the future, but we can't redeploy them all every time this happens, because we will lose our ability to do all those other things that have to keep happening. We can't let future waves impede our ability to protect the public from everything else that we do. So it may very well, and probably does very well, mean that we would have to have additional resources, the ability to hire additional people when needed to respond to future waves of COVID-19.
Thank you, Erica. Dawn Huddleston, do you have a question for Dr. Gardner?
I do, thank you. Just to follow up on the long-term care homes and future testing, I know that there are some homes, one that I'm thinking of in Huntsville in particular, where the residents share rooms. They don't have their own individual spaces. Is that something that you would be considering in terms of prioritizing testing, Dr. Gardner?
Yeah, that is the kind of thing we'd be looking at. We assess, all of the homes in the province have been assessed for their degree of vulnerability on conditions in general, including shared rooms. And the more people in a shared room, the greater the risk, right? The closer the beds are to each other, the greater the risk. So there is a risk ranking that's been done on all of the homes, and all the health units have received that, all of the Ontario health regions have received that, and we will use that information to prioritize not just the testing, but also the visitation that we want to do with those teams that we work together to establish.
You have a follow-up question, Dawn?
I do. Is there anything being done in terms of testing for new residents? I'm assuming that people are still potentially entering these homes. What's the requirements for those people as they're moving into those facilities?
So according to provincial directives, all new residents, new entrants into these premises are to be in isolation for 14 days. Those that are arriving from hospital have to be tested for COVID-19 first, and then when they arrive, go into 14 days of isolation. And if they develop symptoms, they need to be investigated, including testing. And as I've said before, the province wants us to work through testing all of the residents and staff of all of the facilities. That'll take a long time to do. That, I would note, that is a point-in-time test, and cannot be the only safeguard that we take, because a person can be negative today and then become positive tomorrow as they emerge as a case that had been incubating, or could be exposed to a case and become a case. So the negative test done once doesn't protect you against that. You have to have ongoing monitoring and follow-up to safeguard against things happening in the future.
Thank you. Thank you, Dawn. Doug Cross from Muskoka Region, do you have a question?
I do, yes. I was wondering about what's happening at the Beaver Creek Institution these days with the outbreaks they've experienced in long-term care homes. You know, in terms of physical distancing, things like that, there's a lot of similar challenges. Have you had much conversation with that facility in terms of the health of its inmates?
So quite a while ago, there was a case of a worker at that facility. The media has inquired about that before. I've reported that that person doesn't actually live here, so it wasn't on our statistics, but we did follow up with the facility about contacts, and fortunately there were no additional cases that arose from that. We've provided some direction about infection control and personal protective equipment for correctional facilities, but we regard them as being in the category of congregate settings, and we have more work to do on that front, I would say.
I see. And unrelated follow-up question, you talked about the redeployment of your staff and everything that took place there. How did the planning that you might have done for something like this measure up to the reality of what was done? Were you fairly accurate in what needs to be done, or was a lot of this made up as the pandemic progressed?
Thank you for the question. We've had a long history of planning. Over a decade ago, in 2006, we developed our first pandemic. We called it pandemic influenza plan, where everybody was expecting that the pandemic would be influenza and not a coronavirus. And it was useful for the H1N1 influenza pandemic of 2009. And following that experience, we updated our pandemic plan again. And then just last year in November, we completed a infectious diseases emergency response plan. It was drafted to be broader. It was no longer just about a particular organism such as influenza. It was meant to cover up any kind of infectious disease outbreak. And it is very broad in scope, and it talked about all the sorts of measures we're doing, and also included vaccination, which we can't do now because we don't have a vaccine. But as I've indicated, we will, I'm sure, at the end of this all be implementing when the vaccine becomes available. But truthfully, this is the biggest public health incident of over 100 years. And so I had thought that SARS back in 2003 was a major event, and this is 1,000 times bigger in its impact on the world. So I cannot claim that we anticipated this scale and scope and duration, an event that will carry on for well into next year, off and on over time. I would say that although we've done a lot of planning and preparation, this has exceeded our anticipated impacts.
Thank you for that analysis. That's very truthful, it sounds like. Thank you.
You're welcome.
Thank you, Doug. Nathan Schubert from the Moose FM. Do you have a question?
Yes, I do. Good afternoon. Dr. Gardner, I just wanted to ask, as we're getting close to the summer season and cottage country really starts opening up, and even though we've been telling people to really stay away, does the health unit have any plans to best prepare to protect people if the worst comes to worst and we get crowded with cottagers in the region?
Thank you for the question, and I think part of the answer would lie in what will come with de-escalation. What will come with the province's potential easing of restrictions as we get this first wave under control and the numbers of cases come down over time. We're not there yet. We're still having lots of new cases, right? I think we're just at the plateau phase, but and we need all the control measures, but there will come a time when it's coming down. Saskatchewan, for example, is looking at that right now. What would we ease off on and when? There's work being done on that right now in the province, looking at the science of this, looking at what others are recommending on this, looking at right now what other countries or provinces are even doing about this. We've yet to determine when and how we'll ease off on things. So what happens in summer will depend on the phase of this wave and the degree to which it gets under control and the degree to which it comes down. It's possible that you'll get a break in the summer, that this being a respiratory virus, that it will largely have abated, and there'd be a major relaxation, or some degree at least, a relaxation of all of those controls. And that would have implications, of course, for cottaging and people going to cottage country, that if you have an easing of controls, there'd be easing of controls related to that behavior as well. I think in the end, only time will tell how much backing away of the control there will be and how it would coincide with summer. I think it's hard to actually predict right now what we will have to do in the summer versus what we would be able to allow. I have no doubt that people will want to go to their cottages, and even now they very much want to go to their cottages, and certainly in no way would I blame them for wanting to go to their cottages. I myself, although I'm not a cottager, I'm a camper. I like to camp, right? Right now the campgrounds are closed. Time will tell whether or not they're actually open. Time will tell whether or not the province will ease off on the restriction of using Crown land. So I think we're just going to have to see what kind of restrictions are required and then look at how that fits with what people are instead choosing to do, and therefore what kind of enforcement is needed.
Follow-up question. A few weeks ago, we were talking on the phone, and you mentioned how there was a possibility that the virus could decrease in the summer due to the heat. Now we're a few weeks later. Do you still feel that might be the case, or are we at a point where that may not have as much an effect?
It's still hard to tell. We're still in April. You've still got a couple of months before you're getting into the summer. I think we'll just have to wait and see.
Thank you.
Thank you, Nathan. James Fuller, you have a question?
Nothing from me today, thank you.
Okay, thank you. Mandy Webster, do you have a question?
Yeah, I have a couple questions, Dr. Gardner. The first one going back to the long-term care facility. You said that you finished testing everyone at the two places, residents and staff, with 800 tests done. When do we expect to see those results?
I would expect to see the results within the next 24 to 48 hours. Now,
And will you guys, sorry, go ahead.
yeah, and I report again to the media on Monday.
Okay, and will you guys be updating the charts over the weekend with those potential numbers?
We don't plan on it. We haven't been doing that over the weekends.
Okay. Just a quick question in regards to the chart on there now. Is it up to date from yesterday?
It's up to date as of 5 o'clock yesterday.
5 o'clock yesterday. Okay. Thank you.
You're welcome.
Thank you. Thank you, Mandy. Is there anyone on the line that we have neglected to ask?
Mike, speak with you.
Oh, hi, Mike. Go ahead.
Well, doctor, how are you?
I'm doing well. How are you?
Good. Any message to the public right now? What are you seeing? What are you getting reports from that's of concern in Barrie specifically?
I would say that if you look, actually, if you want to have a look at our map, you will be able to have a look at Barrie yourself, and you'd be able to see the specific numbers we have overall for Barrie. So when I click on Barrie, there's been a total of 60 cases, 26 are recovered, 3 are in hospital, and 2 are deceased, and then you have a listing there of all of the cases. Would that?
I'm thinking about in terms of violations, people, let's say on the waterfront, getting too close. Or have you received any complaints or any calls with regard to violators of physical distancing or self-isolation measures?
Well, the city of Barrie has been very active and proactive on this. They've declared a state of emergency. They passed a bylaw that would require physical distancing for people that are out in the community. I think all of that was intended to address their concern that people were violating the need for physical distancing when they were out in public locations, maybe down by the waterfront, that type of thing. I don't know, actually, offhand, what their recent experience has been. It might be instructive for you to actually to speak with the city about it, given that they have the bylaw.
Okay, with regard to the Clinic C, is that still running at RPH? And what has the assessment center numbers been in the last 2 days since we last heard from you?
So we've got an assessment center in Barrie at the Barrie Community Health Center, and their numbers for testing yesterday were 77, the day before was 81, and the day before that was 68. And that's actually considerably higher than the previous week, where it was in the range of 40. Well, I beg your pardon, that's looking at the weekend. It's considerably better during the week than on the weekend. They drop in the weekend, and they're better during the week.
Okay, thank you, Mike. Do you have a follow-up question, or are you good?
Yeah, that Clinic C, is that still running at RPH where you can drive up and get that done? Because I think that's what a lot of people are asking about, because they're doing that right now at Soldiers at the beginning, and that seems to be the best, most conducive, safest way to get things done to a lot of residents.
I don't have that information. How about we have our team get back to you about that today?
No problem.
Okay.
Thank you.
Thank you, Mike. Is there anyone else on the line that we may have missed?
Kathy, I'd like to ask one more question if I could please. It's Mandy from Rogers.
Sure.
Dr. Gardner, in regards to those test results coming back for the 800 people, are you concerned about some of them being negative when in fact they just haven't had the incubation period yet?
Thank you for the question. It's certainly possible, which is why I think a single test has only limited value. If it's positive, it's certainly of value, then you know you've got a case. If it's negative, then it could be a true negative. It could be a false negative because they're incubating. It could be negative today because they don't have it, but tomorrow they get exposed and they become a case. So I think we need to be careful about false reassurance when you have negative tests.
Great, thank you very much.
You're welcome.
Okay, thank you, everyone. I hope you all have a good weekend, and we will see you again on Monday at 12:30.
Goodbye, everybody.
They're different for everybody, and people respond differently, people heal differently, and it's very much trial and error. There's no right or wrong answers. The doctors really don't know. They tell you to avoid certain things, but it's a continuously, they're spending so much time learning about that right now.
Right. Were your doctors from Barrie, or were you sent to Toronto?
I was sent all over.
Were you?
I saw doctors in Barrie. It's actually, the doctors didn't, so the doctor that really changed my life and really set me on to writing was a doctor that said, I don't think you're ever going to be a cop again. Have you been thinking of what you're going to do if you can't get back to being a cop?
So did that drive you to then start when did you start Derailed? APOC Derailed. When did you start writing that?
I started writing this the August after my first novel was released. My first novel came out in April 2013.
And that was called?
APOC.
APOC, okay.
Yeah.
And this is APOC Derailed?
Yes.
All right.
So from the date of your accident to when you started writing, what kind of time span?
So as January of 2011, I started writing. My accident was July 30th of 2011. So 8 months had passed, and I had written 5 chapters in that time. I got in the accident literally that week. One of my friends came and picked me up because I could barely move. He brought me to the source. I bought this little mini laptop that I could put on my lap because I couldn't move very much. And I just started typing.
So starting to type, that involves a lot of discipline. Where does that come from?
Well, my career has been a lot in investigations. I've written well over 200 search warrants, some as long as 350 pages in length. And I think it's the process of working through those search warrants. Like, they have to be written. If we want to catch the bad guy, we have to do the work.
Right.
So it was no different. I wanted to write my book.
Can I see it?
Yeah.
So who's the main character in this?
The main character is Miguel Mejia, and he goes by the name APOC as well.
And how did you come up with that name?
Well, the name,
Yeah.
so the name is actually my biological father's real name. I've never met him. He doesn't know I exist. As I said, my mom was 17 when I was born.
Right.
And I tried to find him and almost found him, but he's since moved, so.
Now, your book, you're having an upcoming book launch.
Yes.
At Farmhouse.
Yes.
And what can we expect there?
So
I hear it's pretty exciting. So
my idea of a book launch is somewhat different than, I guess, a traditional author. I want people to feel that they're in the book. I want people to be wowed rather than me stand in front of a group of people and read the book, which is great. But there's something about the sights, smells, and feels that really propels somebody's imagination.
So it enhances the experience.
Yes.
So if one of our viewers wanted to purchase a book, how would they get it?
Well, there's a couple different ways. The one, you can get it from my website. If you send me a message, we can talk.
And what is
my website's michaelwalton.ca.
Okay.
But it's available. It will be available at all stores. Chapters, Indigo, Barnes & Noble, Kohl's, wherever you buy books, my book's going to be available.
If you can inspire somebody, one of our viewers who wants to write a book.
Yes. You have to sit down and do it. Love it, write it, and just keep writing. I mean, there was many days I just sat there with just the cursor blinking, but every word counts. And sometimes you'll only write a sentence.
Right.
And you have to be content with that, and then come back and rewrite.
Well, you've heard that from Michael Walton. Every word counts. And I really want to appreciate you coming here today.
Well, thank you very much.
Thank you so much.
For having me.
Thank you.
Yeah, it's been great.
And we'll see you next week.
Call the Rogers TV viewer response line, email us, or connect with us on social media.
Working here as a volunteer is a good way to get to know your community. It's a good way to learn how to work as a part of a team, and it's a good way to meet some really wonderful people. Learned a lot from the other volunteers and from the staff coming through here about production techniques. I'm Ken Grant, and I'm a Rogers TV volunteer.
This is Rogers TV.
Central has just been an amazing part of so many people's lives. Because it just had such a huge influence on my life. It made me who I am, basically. And so I had to come back and see the end of it.
Central was that part of my life during that formative teenage years when you go from being a little kid and develop in towards adulthood.
Recognizing the depth of connection that people in the community have had with this school and how far people traveled to come to this reunion was unbelievable.
From 1843 to 2016. Can you match that anywhere else in Canada?
We had an official number of 1,375 registered guests, while we had over 300 that just came to visit the school and walk through the halls. So to be completely accurate, we wouldn't know, but our guesstimation is 1,500 to 1,800 would have visited the school over the course of the weekend.
I had 5 great years here at Central in athletics, basketball, and classics club, and different things like that. Three wonderful musicals I was able to experience. Yeah, just lots of great memories here. It's great to see everyone back here.
Happy memory was the cheerleading team in 1965. We made new uniforms because we had mothers who could sew. And we liked the guys on the basketball team and the football team. And we sat through all the construction of the new wing that's now the old wing. And remember when the auditorium was built, and that was really special.
For me, it was really a kickoff to my journalism career because I ran the yearbook one year. I was the advertising manager. I wrote the columns for the Barrie Examiner. And I was a rookie wannabe reporter. And I had a lot of good encouragement here as well. So it was very important to my avocation.
There was a young girl in the band, her name was Pam Woods, and she wanted to do some track, so she and I would go out after school and train for track. And she would start at the 50-yard line, and I'd start at the 0, and I'd have to try and catch her before she crossed the 100-yard line, and I could never catch her.
Well, it's just funny walking down the hall. April, my friend and I were in the band for 5 years. We went on one of the last European tours, and just coming by her and looking in the window, it's just, you're flooded with nostalgia. It's amazing. We found our picture on the wall. It's really exciting.
Playing classical music, I think really gave me an appreciation for music that kind of set me off for life. And we had just a lot of fun. We got in a lot of trouble. We went to Kirkcaldy in 1985, I think, and that was a lot of fun.
And so, yeah, today was very, very nice to receive that diploma and be able to share that with my family. And my mother was here, and my daughter, and yeah, it's just, you know, I'm sure that's a simple thing for most people, but for me, that's, you know, it's a long time coming, so that's nice. I'm very grateful for the Central to, you know, offer that. I came here for my last year. And yeah, I had friends here who were involved in the athletics, and I wasn't necessarily the most athletic person at that time. I was, you know, discovering art and music and I guess, you know, sort of the things on the outside. And so the guys, you know, the jocks and the athletes and everything, they just kind of liked having me around because I knew how to play the guitar. And they really sort of included me in that, you know, their social structure. So that's kind of one of the fonder memories I have of being here, you know.
I have a fond memory of